general or
motor,
visceral, somatic, all are cranial nerves. Cranial nerve names, okay, attachment to brain, very important, arise from telancephalon, arise from diencephalon, arise from midbrain, myelencephalon or mesencephalon, okay, and exit, which part exit? Exit of the oval foramen, rotundum foramen, jugular foramen, and the superior orbital fissure, and function, sensory function, sensory general function, sensory special function, motor function, parasympathetic function, okay, and regions they supply which part of the body supplied by these neurons. Names of cranial neurons. Olfactory just contains one fiber, sensory special, okay, smelling, sensory, optic, okay, visual, then contains one fiber, special fiber. Oculomotor contains two fiber, one fiber motor, another fiber parasympathetic. Parasympathetic, and trochlear contains just one fiber, function only motor, okay, only motor, nerve supply of the superior oblique muscles, Oculomotor contains two fibers. One fiber motor, another fiber parasympathetic. Motor nucleus, motor nucleus, and this nucleus, Edinger parasympathetic, Edinger Westphal nucleus. Edinger Westphal nucleus parasympathetic fibers contains parasympathetic fiber, and the motor parasympathetic is motor, okay, innervated of muscles. All of muscles of the eyeball, nerve supplied by motor fibers, okay, motor fibers, and this contains two fibers. Optic contains one fiber, oculomotor, olfactory contains one fiber, optic contains one fiber, oculomotor two fibers, trochlear contains one fiber, CN1, CN2, CN4, CN3, CN5 contains four fibers, CN5, trigeminal. Trigeminal contains any fibers, one fiber, somatic sensory. Somatic sensory, one fiber, visceral, another fibers, motor, three fibers, special, this contains three fibers, sensory, general. Okay, sensory general skin, nerve supply of skin. Okay, but proprioceptive, okay, special. And another testing fibers. Okay, another CN3, special sensory, special sensory apparent of the sensory of tongue. Okay, sensory 1, 2, sensory somatic or general somatic, and sensory visceral tongue. Okay, visceral tongue, somatic skin of face. Okay, afferent fibers contains 3 fibers. One fibers and motor fibers. Okay, motor fibers and little lateral rectus muscles. Okay, and facial CN 6, CN 7. Okay, CN 7 contains 4 fibers. One fibers motor, innervated or all muscles, expression or superficial, all muscles of the face. Okay, innervated by motor fiber. Okay, and another fiber, parasympathetic fiber. Parasympathetic fiber, parasympathetic fiber, secretion of submandibular, secretion, all are accessory salivatory gland, all are paranasal, mucosal, maxillar, frontal, ethmoid, except parotid glands. Parotid gland secretion by glossopharyngeal nerve. Okay, 2. And another fibers, sensory fibers, somatic fibers, skin of the external ear. Okay, external ear, sensory and sensory general. Sensory special, another fiber, sensory special, testing of tongue. Okay, tongue, 2, 3 part, and 1, 3 part, 2, 3 part testing, afferent by cortical tympani fibers, facial contains any fibers, sensory general and sensory visceral. Okay, sensory visceral, 1, 2, 3, 4, 5, 4 fibers. Optic, just 1 fiber, okay, but facial, 4 fibers. Okay, 4 function. 1 function motor, another function okay, testing and somatic, sensory general or somatic skin, visceral, okay, tongue, okay, and another vestibulocochlear contains just 1 fibers, vestibulocochlear, bipolar neuron, vestibulocochlear nerve contains CN8. Okay, just 1 fiber, bipolar neuron function, hearing and balance. Okay, contains and 9 CN9 contains 1 fibers motor, innervated of stylopharyngeus muscles, motor fiber, innervated stylopharyngeus muscles, innervated from motor fibers, and another fibers, parasympathetic fibers, parasympathetic innervated salivatory of the parotid gland, secretion of parotid gland. Okay, and another fibers, testing fibers, visceral fiber, testing fibers, 1, 3, posterior part of the tongue. Testing fibers apparent by glossopharyngeal. Okay, glossopharyngeal and testing fibers, and visceral fibers of the this part, testing fibers and visceral fibers. Visceral painful of the one posterior part of the tongue apparent by visceral fibers. Okay, visceral fibers and testing fibers. Contains any fibers, 4 fibers: motor fiber, parasympathetic fiber, testing fiber, and visceral sensory. Visceral sensory different by somatic sensory. Somatic sensory, okay, in parts of the skin. But visceral sensory, okay, in parts, okay, in parts of the visceral, nasal, tongue, okay, intragastric, stomach, esophageal, and larynx, visceral, but skin, somatic. Okay, contains any fibers. Okay, and 10 Okay, 10 fiber vagus. Vagus contain any fiber. Vagus CN10 contains any fiber. 4 fibers. 1 fibers, motor, innervated all of muscles of larynx. Motor fibers, 1, motor fibers, and parasympathetic fibers, parasympathetic fibers, secretion of the esophagus, secretion of the stomach, secretion of small intestine, secretion of ascending colon, and entire right of this transverse colon, secretion by motor fibers of CN10 vagus. And another testing of the root of tongue. Okay, visceral of root of tongue and testing and visceral. Okay, contain 4 fibers. And CN11 contains any fiber. 1, just motor fibers. Accessory nerve, innervated of sternocleidomastoid, innervated of trapezius muscles, and innervated of the pharynx. Okay, just one fibers, motor, innervated nerve supply of just muscles, not the skin, not visceral fibers, and 12, okay, or CN, okay, 12 hypoglossal just contains any fibers? One fibers, just motor, innervated all of muscles of the tongue except halatoglossus, okay, just muscles. Cranial, vagus, parasympathetical, okay, parasympathetical of the vagus, which part here? Okay, cardiac. Okay, cardiac, preparation function of the cardiac parasympathetic fibers. Okay, vagus. Vagus contain 4 fibers, CNN when accessory 1 fibers, hypoglossum 1 fibers, in case sheep. This okay, lumen or sheep contains 1 fibers. CN parasympathetic contains which CN parasympathetic fibers, parasympathetic, which 3, okay, CN 3, okay, CN 7, okay, CN 9, okay, CN 10, okay, 1, 2, 3, 4, 5 contains parasympathetic fibers, okay, just 8 free parasympathetic fibers, 8 cranial nerves. Did you understand? Which cranial, all of cranial nerve contains parasympathetic fibers except CN4, CN3, CN7, CN9. CN4 just 1 fibers, okay, motor fibers. Did you understand cranial nerves? Okay. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, function. Bipolar neuron, okay, receipt of the impulse of kardar,
Smell.
okay,
Smell.
smelling, okay, smell function, and optic, visual, okay, visual area, optic, and another oculomotor, ciliary, innervated of ciliary muscles, a sphincter of pupil, okay, sphincter of pupil, meiosis, mydriasis or meiosis of the innervated of ciliary muscles, a sphincter of pupil, all up external eye muscles, all up, superior rectus muscles, inferior rectus muscles, medial rectus muscles, inferior oblique muscles, and levator palpebral superior muscles, nerve supplied by oculomotor, and lateral rectus muscles innervated by abducens, superior oblique muscles innervated by trochlear, abducens, lateral rectus, this is rectus, abducens, lateral rectus, all of muscles, and another 4, 5. This oculomotor pupil and sphincter branches from Edinger festival, parasympathetic. Okay? okay, ciliary muscles and sphincter of pupil branches from Edinger-Westphalian nucleus. But all of external eye muscles, okay, branches from motor nucleus. Okay, and another muscles 5 to trigeminal, 5 trigeminal sensory phase, sinuses, teeth, okay, ophthalmic, maxillary, mandibular, action, this part, somatic fibers, and the visceral fibers, okay, tongue, okay, and another muscles, this is muscles, motor fibers innervated of temporalis muscles, lateral pterygoid muscles, medial pterygoid muscles, and masseteric muscles. This part motor. Maxillary, ophthalmic and maxillary branch of the trigeminal nerve, all are fiber sensory. But mandibular contains 2 fibers. Fibers of sensory, fibers of motor. Motor innervated of motor muscles of mastication. All of muscles of mastication contains 4 muscles. Lateral pterygoid, medial pterygoid, and temporalis and masseteric muscles. And facial muscles innervated from motor fibers of the facial, and another facial sensory intermediate neuron, motor, submandibular, sublingual, lacrimal gland, testing, anterior to type of tongue, sensory subpalatine. Okay, sensory fibers, motor fibers, testing fibers, somatic fibers, function of the facial, and the vestibulocochlear, just sensory fibers, special. Hearing and balance. Hearing, okay, cochlear and vestibular, semicircular, and another muscles 9, glossopharyngeal, contain fiber testing. Testing, posterior, one side of the tongue, sensory, tonsil, pharyngeal middle, visceral, and motor stylopharyngeus, upper, pharyngeal muscles, parotid gland, secretion, and another fibers, vagus 10, motor hair, lungs, palatine, pharynx, larynx, trachea, branch, and gastrointestinal tract. Okay, bronchial, larynx, pharynx, gastrointestinal tract, external ear. External ear, nerve supply by somatic fibers, and muscles, larynx muscles, and motor fibers. And testing, posterior part of the tongue or root of tongue, testing, another fibers. And visceral fibers, intestine, stomach, okay, contains 4 fibers. And another fibers, accessory sternocleidomastoid, trapezius muscles. And 12 of cranial 12, hypoglossal, tongue muscles. All of tongue muscles innervated this part. Okay, no problem this part. Oculomotor function, olfactory, oculomotor, olfaction, optic, vision, oculomotor, eye movement, parasympathetic, innervation of eye, trochlear, eye movement, trigeminal general sensation from head, motor to muscles of mastication, and abducent eye movement, visual, facial testing, facial movement, parasympathetic innervation of salivatory and lacrimal gland, okay, vestibulocochlear, vestibular cells, and hearing function. But glossopharyngeal testing, general sensory and motor innervation of pharynx, visceral innervation from carotid body and carotid sinuses, parasympathetic innervation of salivatory gland, vagus, general sensory, okay, somatic, and motor innervation of pharynx, larynx, and esophagus, visceral innervation from thorax and abdomen, loading aortic body and arch, parasympathetic innervation of thoracic, okay, contains 4 fibers, and accessory just movement of head and shoulder, okay, sternocleidomastoid and trapezius, okay, and back, cranial 12, hypoglossal, just movement of the tongue, okay, no problem this part.
No problem.
The 12 pairs of cranial nerves are part of the peripheral nervous system, PNS nerves, ganglia, spinal nerve, and cranial nerve. The spinal nerve, any number, spinal
31.
31. Any number of the cranial? 12. Okay. The PNS has 2 deviations. Spinal part consists of spinal nerve, and cranial part consists of the cranial nerves. Difference cranial nerves and spinal. Cranial nerves attached to brain, not spinal cord. Okay, but cranial nerve not formed by union of the anterior and posterior rami. Cranial nerves do not from plexus, but spinal nerve formation of plexus, cervical plexus, brachial plexus, lumbar plexus, sacrococcygeal plexus. Okay, but another mouse cranial nerves attached to brain stem. Okay, olfactory telencephalon, optic telencephalon, and oculomotor midbrain, and another cranial nerves arise from brain stem. All of cranial nerves emerge, but the many emerge pass, okay, exit, okay, عبور میکنه from or attached to the ventral anterior brain of brain stem. Exception trochlear nerve. Trochlear nerve, okay, emerges from posterior. Thank you. Okay, posterior. Okay, all of this is trochlear posterior. Cranial nerve, spinal cranial nerve, exit cranial cavity of the skull to supply regions of the head and neck, canals, meatus, fissure, and foramen. Canal, foramen, fissure, and hiatus. What's the meaning? Similarities, okay, cranial nerve and spinal. Cranial nerve, like spinal nerve, are associated with sensory ganglion, trigeminal ganglion, cranial nerves. Okay, cranial nerve, trigeminal ganglion, facial, vestibulocochlear, glossopharyngeal, vagus. Sensory ganglion, trigeminal ganglion, facial, geniculate ganglion and vestibular cochlear and vestibular ganglion, glossopharyngeal superior and inferior, and superior and inferior ganglion. Cranial nerves, like spinal nerve, are associated with autonomic fibers. Oculomotor fibers, parasympathetic. Ganglion ciliary, facial, parasympathetic, petricopalatal ganglion, facial, submandibular ganglion, glossopharyngeal, otic ganglion, and vagus intramural. Intramural, the name is intramural. Intramural means internal of the intestine. Intramural, mural layer of the intestine. Okay, and thoracic and abdominal cavity. Okay, and the motor nucleus, parasympathetic nucleus, sensory nucleus, function grouping of the cranial nerves. Purely sensory 1, 2 purely خالص. Okay, just purely, what's the meaning? Purely خالص. Okay, just one fibers. Okay, sensory one fibers. 2 olfactory, optic, vestibulocochlear, mainly motor. 3, 4, 5, 9, and 12. But mixed, sensory or motor. Mixed, sensory or motor. 5, trigeminal, facial, glossopharyngeal, and vagus. Okay. Function grouping of cranial nerve, purely sensory cranial nerve, CN olfactory smell, CN vision, CM8 vestibulocochlear, hearing and balance. Functional components, special sensory fibers. Okay, special sensory fibers. Which cranial nerve special sensory fibers contain special sensory fibers? Okay.
1, 2, and 8.
Okay, olfactory, optic, and vestibulocochlear.
Exercise.
CN1 olfactory nerve, bipolar nerve, nasal cavity, special sensory smell. Okay, and this part, left olfactory bulb, termination of olfactory nerve, formation of olfactory bulb, olfactory tract. Smell, bipolar neurons, the bipolar neuron, olfactory, ears, cilia. Ears, cilia, emerge which part of the ethmoidal bone, axon of olfactory neuron, emerge which parts of the ethmoidal? Fibers of olfactory nerve arise from olfactory area of the nasal. Okay, but receipt of the impulse by dendrite. Axon emerges or passes which parts of the ethmoidal bone?
Cribriform plate.
Cribriform. Okay, cribriform plate. Cribriform plate. Cribriform plate contains any foramen. Okay, any foramen. Olfactory nerve. Olfactory nerve fibers and glomerulus formation and neurons of tufted cell, mitral cell histology. Now this part importance. Okay, and bulb, tract, lateral olfactory stereo, medial olfactory stereo, anterior perforated area, optic, okay, optic eyeball, optic tube, special sensory vision, chiasma optic, and optic tract, lateral geniculate nucleus and superior colliculus, center of the optic or visual area. Optic neuron, optic chiasma, optic tract. Okay, this part each of the special cells. Okay, special cells, optic reflex, and two vestibulocochlear CN8 vestibulocochlear nerve, special sensory hearing and balance, contains two ganglion, spiral ganglion and vestibular ganglion. A spiral ganglion and spiral, this part spiral ganglion. Vestibular ganglion, inferior cerebral, these parts of the ganglion of spiral, spatial, vestibulocochlear, medial, ganglion, spiral ganglion, cochlear or spiral ganglion. Spiral ganglion connected by cochlear branch of nerve, but vestibular ganglion joined by vestibular fibers. Okay. Cochlear, anterior cochlear nucleus, a spiral ganglion, and posterior cochlear or dorsal cochlear nucleus. This nucleus cross are the causation left and right, formation of lateral laminiskis, and synaptic by inferior colliculus and medial geniculate body and temporalis. Okay. Mainly motor cranial nerve, oculomotor, trochlear, abducens, accessory, hypoglossal. Functional component, skeletal motor fibers. Okay, accessory, hypoglossal, movement of the tongue. Okay, exit of the upper, lower. Okay, and another components, trochlear, movement of the eye, abducens eye, accessory, flexion, elevation of the shoulder, oculomotor, movement of the eye. CN3, oculomotor nerve, components, skeletal motor 2, 4, extrinsic muscles, and levator, palpebral, superior, visual motor, parasympathetic, preganglion fibers, synaptic in ciliary ganglion, innervated ciliary muscles, and sphincter papilla in the eye. CN oculomotor nerve, innervated ocular muscles of the eye, innervated ocular muscles. Oculomotor 1, 2, 3, 4, 5 muscles innervated by oculomotor and trochlear just superior oblique, and lateral just innervated by lateral abducens. Dissection type, note the relationship of CN3 to posterior cerebral and superior cerebellar artery. CN4 trochlear nerve, component, skeletal motor, innervated superior oblique muscle, just extrinsic muscles, arise from the dorsal side of the, arise from the trochlear nerve, arise from the dorsal side of the midbrain. CN4 is the only motor nerve, cranial or spinal, that arises from the dorsal aspect or side of the CNS. Motor nucleus, trochlear nerve, innervated of superior oblique muscles, and CN6, abducent nerve component, skeletal motor, innervated lateral rectus muscles, extrinsic muscles, motor fibers. CN6, spinal nerve, skeletal, okay. These muscles, accessory contains two root, accessory nerve contains two root. This root, spinal root of accessory nerves from C1, C2, 3, 4, 5, but cranial root accessory nerve joins vagus nerve and the recurrent laryngeal nerve supply muscles of the larynx except cricothyroid. This cranial root and the spinal root of the accessory nerve communicating or joined by emerge of the jugular foramen. CN11 accessory nerve, CN cross the posterior triangular of the neck. CN12 hypoglossal nerve component, skeletal motor, innervated all of muscles of the tongue, both intrinsic and extrinsic except palatogloss muscles, arise as many rootless from medulla between of the olive and pyramid. Olive and pyramid, between of the olive and pyramid. Motor nucleus. Cerebral cortex. This is nucleus of the hypoglossal nerve. Location, which part of the brain? Brainstem, medulla. Okay, medulla oblongata. This is nucleus, high nucleus of hypoglossal and fibers. Hypoglossal nerve, inferior, all of motor fibers of the genioglossus muscles, hyoglossus muscles, superior and inferior longitudinal muscles, and styloglossus muscles, except palatoglossus muscles. Palatoglossus muscles innervated from accessory nerve. Hypoglossal nerve, C1 not that C1 motor fibers. It is together by C1. Together by C1. Innervated all of muscles of the tongue, hypoglossal, innervated of the tongue, and mixed cranial nerves, trigeminal, facial, glossopharyngeal, vagus. Carry motor and sensory fibers, carry somatic and visceral fibers. CN7 trigeminal nerve. Trigeminal is the largest cranial nerve. Largest cranial nerve, trigeminal. Longest cranial nerve, vagus. Okay, longest, okay, but vagus, largest trigeminal nerve. It arise, beginning, okay, beginning, and from the pons in two parts. Sensory root largest, motor root small. Trigeminal is the major sensory nerve of the face, major sensory of the face, because receive of the parts of the face, and Functions, components, somatic sensory, skin of the face, Upper part of the neck, middle part, maxillary, lower part, visceral sensory, mucosal, membranes of the nose and mouth, skeletal, mastication, chewing. What's the meaning? This is chewing muscles, mastication or chewing muscles, and other trigeminal sensory nucleus, spinal nucleus, mesal, cephalic nucleus, and motor nucleus contain 4 muscles in ophthalmic, maxillary, mandibular, deviation of 3, this part, trigeminal motor, masticator nucleus, mesencephalic nucleus, facial nerve. The facial nerve arises from the lower bones in 2 parts, motor root and intermediate root. Nervous intermediate carries. What's the meaning carry? What's the meaning carry?
Buradan.
Okay, same. Okay, and carries general sensory fibers, tasting fibers, and visceral motor parasympathetic fibers. Okay, somatic sensory, skin of external ear, small visceral sensory tasting part of the anterior 2 tiles of the tongue, visceral motor parasympathetic salivatory and lacrimal gland, skeletal muscles of facial expression, just and odor expression. Okay, motor nucleus, parasympathetic nucleus, sensory nucleus, facial in the temporal bone, glossopharyngeal, CM, receive. What's the meaning? Receive. Okay, name because it is sensory to the posterior tongue and the pharynx. It innervated of muscles, one muscles, the stylopharyngeus, just one muscle innervated by glossopharyngeal or motor fibers, smallest fibers, but largest fibers of the glossopharyngeal sensory. Sensory functional component, visceral sensory, mucosal membrane, middle ear, posterior tongue, and throat. Okay, and visceral sensory testing posterior 1 tile of the tongue, visceral sensory baroreceptor of carotid sinuses, chemoreceptor carotid sinuses, visceral motor parasympathetic innervated carotid gland, skeletal just 1 muscle, stylopharyngeus. Motor nucleus, parasympathetic nucleus, sensory nucleus contains 3. CN vagus. Vagus nerve, CNI received its name because it goes wandering, okay, through the neck, thorax, and abdomen. Supplies external ear, pharynx, larynx, thoracic, and the organ of abdomen, organ of far distal as left colic flexure, okay, colic flexure. Function, somatic sensory, skin of the external ear and eardrum or tympanic membrane, visceral sensory, mucosal membrane of lower throat and larynx, visceral sensory testing. Which part testing? Epiglottis and palatine, epiglottic anterior part of root of tongue, visceral motor parasympathetic, cardiac, stomach, skeletal, palatine, pharynx, and larynx muscles. Olfactory, okay, vision, no problem, and finish. Okay.